So this morning, we're glad to be joined live by Dr. Dana Hawkinson from the University of Kansas Health System to talk more about this topic. Doctor, thank you so much for joining us. We've talked about masks now for 3 months. It feels like we've asked you something about masks almost weekly, but now this is a whole different kind of question because they're going to be required on a large scale. How much of a difference does it make when everyone is wearing them versus just sporadically a few people here and there?
Yeah, I think we're going to see that, to answer your question, it's going to make a lot of difference. I think we need to continue to maintain physical distancing and do the proper hand hygiene and really not manipulate the mask at all. But we do have good population data, peer-reviewed journal articles that show that countries in which there were mandated masks have a decreased rate of spread of the disease and a decreased rate of mortality compared to countries that don't. So I think it's going to be a good culture change. Again, it's not wearing masks all the time everywhere. It's when you're in those situations where you can't physically distance or you're in confined spaces. I think overall it will be a good thing. Hopefully it'll be a short-term thing. But, you know, as we move forward, we really just want to stop the spread of the disease and everything that comes with it.
You mentioned not manipulating, not touching your mask while you were in those situations, really important. Have we learned anything new since this all started, or even in the last several weeks, about what social distance is effective or what kind of masks are more effective than others? Anything that you've been surprised by?
I think more just the social and physical distancing is really going to be the main component of this. And there are articles out suggesting that as well and backing that up. So when you have the physical and social distancing, when you have the mask wearing and the proper hand hygiene, we know that we can decrease the spread of the disease. You know, maybe the silver lining of this as we move into now influenza season and other respiratory diseases, hopefully that will decrease the amount of influenza people have as well, because we certainly don't want to have somebody with two viral infections, such as influenza and COVID, or COVID and another common cough or cold. We know that can happen. Initially, we didn't see a lot of infections like that with co-infection, but we were at the end of the influenza season. Now we're going to be going into it and be at the height of it. So I think hopefully that will keep people protected from influenza as well as COVID.
Doctor, I want to ask you about the exemptions. We had a list of exemptions of why people shouldn't or don't have to wear one necessarily. One of the big ones on that is if you have a medical condition or a doctor telling you that you shouldn't be wearing a mask. I want to show a video here. There was a video that went viral. A lot of people saw this, of a woman refusing to wear one. This is at a grocery store in California. After this video went viral, she said she had a medical condition. That's why she couldn't wear one. So locally, if someone's in that same kind of situation where they have to be out but they have a medical condition, what do you suggest for those people? Is it unwise for them to even be out? Should they wear one of those plastic shields necessarily? What's the best course if you medically shouldn't wear a mask?
Yeah, that's a good question. You know, that does get into certainly people's private health information, unless they're willing to. I don't know if a doctor's note is going to be good. Certainly not going out unless you really need to is going to be important. The plastic face shield may be okay. I think I've seen a couple of those advertised. You know, certainly that's not the mask. That is still allows some space between the outside environment and the mask shield, so you can still express the virus. You know, as we move forward, we see this all the time with people who have either other types of religious exemptions or philosophical or medical exemptions, and for influenza vaccine, obviously a mask is different than a drug or a vaccine. So moving forward, that is going to be something that you know, we all need to kind of work at and determine what is the best way to go about that, because absolutely there are people who cannot tolerate masks for legitimate, concrete medical reasons. What is the best way for them to go about? Certainly we don't want mask shaming. There has been mask shaming for wearing masks, for not wearing masks. We just need everybody to try it the best now that there are the mandates in place to do that and get to that point of wearing the mask if they can. We understand it's probably for a short period of time if you're just running an errand in a store. So if you can tolerate it, obviously you're going to be able to try to tolerate as much as possible. We don't want anybody to be bullied or have mass shaming for one reason or another. Hopefully the culture will change overall, and we'll get through this. But for right now, as best we can, everybody should be trying to wear a mask unless they have those medical conditions, obviously.
I just wanted to ask quickly, Doctor, we know that the Kansas City, Missouri mandate is in place for 2 weeks, and then they say they'll reevaluate. When do you expect that we will start to see a difference? Is this just a matter of weeks where we can reevaluate, or what do you think is going to happen?
Yeah, the 2-week period we've been using since day one was really based on the fact that the majority of people who are going to have symptoms are going to have symptoms by 11 or 12 days. Probably almost all people who will have symptoms by 14 days as an incubation period. So that has been in place since day one. I think what we have seen as far as trends and surges and numbers of infections going up, we've seen that actually takes place 3 to 4 to 5 weeks down the line. You know, I think a week or 10 days ago, Dr. Fauci even said, well, now we are seeing the surge from Memorial Day. So we see, as far as infections goes, that is delayed. When will we see the effects of the mask wearing? I suspect it probably will not be for several weeks. Certainly more than 2 weeks. I think setting a 2-week time frame to see how things are going and reevaluate is absolutely a smart thing to do. But for the overall effects and the spread of the virus, it probably will not be for 3 or 4 weeks after that.
All right, as always, Dr. Hawkinson, thank you for your time this morning. Really good information. Lots of big questions as we move forward with these new mandates in place. Thank you very much.